name is Jessica Juber. I'm a physician assistant at Access Healthcare here in Brigham City. I was born and raised in Idaho. I was there most of my life, all the way up until I graduated college and went to my master's program. I was raised by a very avid outdoorsman for a father and really enjoy fishing, camping, hiking, those type of things, which I think is what brought me back to Utah, back to my roots and to the area that I love. I had a very interesting experience as a child. My younger sister, she's just a year younger than I am, was born with a couple different heart defects, and that required us to drive down here to Utah to Primary Children's multiple times a year. And I spent a good amount of time in that hospital watching the doctors, and I remember even at a very young age seeing them and seeing how caring they were and what they did for my sister. It really impressed me and left something with me that carried through as I grew up and went to school and started to decide what I wanted to be. And seeing how they changed our lives in a way and were able to help other people through their medical practice, I was really impressed by that. And that's what made me want to become a provider. I have loved working at Access Healthcare. I think that it is very interesting that we can do urgent care as well as family practice. It gives such a broad range as a provider of the things I'm able to see and the things I'm able to care for. It keeps me on my toes and up to date on the things that I need to know, and it makes for a really enjoyable day. I have worked in a couple different clinics before coming here to Access. I worked right out of PA school in a pediatric clinic in Brownsville, Texas, right down on the very border of Mexico. I was fascinated by that clinic and the work that we did there. We saw a little bit of a different population down in that region. Being so close to Mexico, we did see people who would come across the border for better health care. It was a very busy clinic. I was seeing between 30 and 40 patients a day. And as a new grad, it put me right into the work, and it was really enjoyable, and I learned a lot from that experience. After that, I was able to practice in a family practice, a nonprofit actually up in Oregon. And again, it gave me a broad range of people that I was able to see, and with family practice I really learned how much I enjoy creating relationships with my patients, seeing them on a continuing and ongoing basis and getting to know them. It was an enjoyable experience. Thinking about amazing or touching experiences, it's really hard to pick just one. I've been in the field for about 6 years now, and I've seen so many different things during that time. I think the most amazing aspect to me in general is the fact that through my practice I've seen life come into the world, and I've also seen life leave the world. And to be a part of helping those people and doing whatever we can to help them medically is pretty awesome and humbling experience. My specialties are fairly broad. Family practice encompasses a lot of different things. I enjoy working with chronic type conditions, whether it's diabetes or hypertension, preventative medicine. Those things are very interesting to me, and I love helping patients accomplish those goals that they have for themselves. As I mentioned, I did work for a while at a pediatric office. I love working with kids, which has been enjoyable to continue at my current position. Just want the community here in Brigham City to know a little bit more about Access Healthcare. I think a lot of people don't even know that we're here yet or remember us sometimes. The community to remember that we're a locally owned business. We love to serve you, and we're grateful for the opportunity to do so. As an urgent care, are open extended hours. We're open Monday through Saturday from 10 a.m. to 8 p.m. And we can do the urgent care, but we can also do the family practice even during those extended hours. It gives a lot of flexibility, and I think it's something that Brigham really needs, and I hope that it's something that's useful to the patients that we can see.